Well, my friends, to teach the junior homeopaths to increase their ability, I have always the tendency to demonstrate something every day from my clinic. But due to rush of patients and for their lack of time, it is not always possible to show all the cases, to demonstrate all the cases. But in spite of that, keep out of some time, I do like to demonstrate some cases. At present, I like to show a case of psoriasis of a girl aged about only 14 years. Only 14 years. Now, psoriasis, about psoriasis, you know that it is a chronic, inflammatory, hyperproliferative, a chronic, inflammatory, hyperproliferative skin disease. It is a kind of skin disease, chronic in nature, hyperproliferative, চামড়ার উপরে ফুলে ওঠে. It is characterized by well-defined erythematous scaly plaques. Scaly plaques. Scaly, খোসের মতন উঠতে থাকে. Scaly plaques in different forms. In different forms. Many of you have seen some are circular in different shapes. It has not a particular one shape, it has different shapes. I have shown you some of the pictures of psoriasis in different types, in different characters. So, it is characterized by scaly plaques, particularly affecting the extensor surface of the forearm. হাতের সামনের দিকেই প্রথমে সবথেকে বেশি আরম্ভ হয়, and also in the scalp, over the nails and nail margins, and usually follows a relapsing and remitting course. চলে যায় আবার কিছুদিন পরে দেখা দেয়. আমাদের অনেক চিকিৎসকরা যে ফেজটাই চলে যায় তখনকার একটা ছবি ফেসবুকে দিয়ে নাটক করে যে আমি সারিয়েছি. They are doing drama. In the remitting phase, যখনই কমে যায়, when it becomes lessen, they claim that I have cured, but the disease is not still cured. It occurs in both sexes at any age, but generally not found before 5 years of age, and generally mostly occur at the teenage between 15 to 30 years. The teenage or early adult years often the victims of psoriasis. Both genetic and environmental factors are responsible. Both genetic and environmental factors are responsible. Now, there are different types. কারণটা কি হয় কেন? In many cases it is idiopathic. কারণ সঠিকভাবে জানা যায় না. Just few minutes back I have told you the genetic factors are important, but also environmental factors. What are the environmental factors? The environmental factors are trauma. অনেক সময় আঘাত লেগে অপারেশনের পর থেকে, সেই দাগের পর থেকে হতে পারে. সানলাইট, অনেক ক্ষেত্রে দেখা গেছে excessive sunlight বা sun heat is the cause. Psoriasis may occur or worsen after sun exposure, especially in the tropical countries. Drugs, some allopathic drugs, if continued for a long time, may produce such types of skin disease like psoriasis. And of course, like many diseases, it is also psychological. Psychogenic factors are important. Anxiety and stress may exacerbate. Anxiety and stress may exacerbate psoriasis. So different types. I have shown you the different types. The most important and the common variety is plague type, যেটা খোসা খোসা উঠতে থাকে. This is the most common presentation and usually represents more stable disease. এছাড়া আরও অনেক ভ্যারাইটিস আছে. এরিথ্রোডার্মিক, তাদেরকে বলা হয় এরিথ্রোডার্মিক, গ্লুটি, পাস্টুলাস. There are different varieties. The treatment, along with the treatment, counseling is also very, very important factors. So this is about the practice of medicine aspect of psoriasis, about the knowledge of this disease. I have demonstrated few points. Now for this patient, our patient, which medicine is required? Our patient having age of 14 years, the patient has brought from the distance of Bengal. She has been suffering 5 years, treated by ointment and also homeopathic treatment. Homeopathic treatment, you know, nowadays the homeopathic treatment, which I have called, so-called the masla muri. The masla muri is also applied. I do not want to show the name of the physicians. Bacillinum 200, Marksol, with these Aspidosperma, Sorinum, Brimstone, 5-phos, etc. I do not like to show the prescriptions. The Chidingmas Company, P. Banerjee Homeopathic Research Center, the P. Banerjee already died, and the business center is still live, and there are some fixed medicines, camphor, antimicrote, coffea, sanguinaria, whatever they like, whatever the medicine comes in mind. No question of disease diagnosis, no question of analysis of symptoms, no question of case taking. These bastards are prescribing homeopathic medicines at random from A to Z. Such bastards in homeopathy are never found and not found anywhere in the world. One bastard has died, but the center is running by some rented homeopathic physicians. So you have seen that the bastards are prescribed so many medicines without knowledge of proper homeopathy. The symptom of this girl represents brimstones very easily because numbers of ointments have already applied. There is aversion to bathing, a strong desire for sweets, bathing aversion, and applied many ointments. And the physical makeup of the girl, I am showing the physical makeup of the girl, is tall, slender, narrow, physical makeup. So physical makeup, desire for sweets, aversion to bathing. Previously she was chilly. Day by day she becoming hot. So hot patient, suppression of skin disease by applying number of ointments, desire for sweets, strong aversion to bathing indicates nothing but brimstone. But the bastards are prescribed numbers of medicines without any rule, without following any case taking, without following any knowledge in ABC of homeopathy. আপনার মেয়ে কি মিষ্টি খেতে ভালোবাসে বললেন? খুব ভালোবাসে? জোরে বলুন। স্ট্রং ডিজায়ার ফর সুইটস। ও চান করতে ভালোবাসে? চান করতে খুব একটা পছন্দ করে না। সো ইউ হ্যাভ হার্ড ফ্রম হার মাদার গ্রেট ডিজায়ার ফর সুইটস, স্ট্রং অ্যাভারশন টু বেদিং, অ্যান্ড হ্যাভ অ্যাপ্লাইড। মলম লাগিয়েছেন, চিকিৎসা করেছেন অনেক, হোমিওপ্যাথি, অ্যালোপ্যাথি। হোমিওপ্যাথি ডাক্তাররা ওষুধ দিয়েছে, অ্যালোপ্যাথি ডাক্তাররা মলম দিয়েছে। And this physical makeup, let's see the result, my friends. So brimstone in 50 millisiemens scale of potencies, I do like to prescribe 1, 2, 3, 4 once daily in the morning. I shall share you the results. I am showing some of the parts of this girl which is visible in the forearm area. I have already told you this disease primarily affects the forearm, extensor surface of the forearm. It is also in legs and other parts of the body. I am not showing. So please remember this video and let's see the result, how much improve we can expect. The one problem is that the bastard homeopaths prescribe number of medicines without any symptoms, complicate the case. The case becomes complicated. রান্নায় যেমন অনেকের নির্দিষ্ট রুল না মেনে they are giving 1 kilogram of sweets, 1 kilograms of salt, mass amount of green chilies, etc., etc., and the curry becomes waste. Similarly, our cases become spoiled by those bastard homeopaths. And in the age of therapeutic nihilism, when so many bastards are practicing as a homeopath, its survival will come only through the comprehensive study of organon and the Hahnemannian process of case taking. And I am the soldier of Hahnemann. I am trying utmost myself to maintain, to keep, to save Hahnemannian homeopathy, my friends.